Hello, everyone. I'm Stacy Ravelis, Advocacy and Programs Associate for CFRI, the Cystic Fibrosis Research Institute, and I welcome you to what promises to be an extremely interesting podcast on cystic fibrosis and inflammation with Levi Johnson, a registered dietitian who also has CF himself. Before we get started, please note that the information and insights shared in this recording should not be used for medical advice, diagnosis, or treatment. Please consult with your physician before making any changes to your health management plan. We thank our sponsors whose support has made this possible: Vertex Pharmaceuticals, Chiesi USA, Gilead Sciences, Genentech, and Viatris. Levi Johnson was diagnosed with cystic fibrosis at the age of 3 months in 1996 and spent much of his childhood between hospital visits and living his passion competing in rodeos. Levi received his education at California State University, Chico, in nutrition and food science. He and his wife, Melanie, currently reside in Washington. We are honored that Levi Johnson is here to talk with us about this topic. And with that, I welcome you, Levi.
Well, thank you for having me. It's definitely an honor and to be able to share my knowledge with the CF community. My name is Levi. I'm 25. I am a registered dietitian. I grew up in Northern California in smaller town, rural setting. I did have a very uncommon hobby growing up, and that was rodeo. I rode bulls from the time I was 11 until I was about 18. I got into it I was able to attend a local event when I was 6 years old, and I just love the atmosphere. I got to meet the cowboys behind the chutes, all that sort of stuff. And that just really stuck with me. And so I bugged my parents. And I did it for as long as I can remember. It was probably the best time of my life. During high school was really when I started showing interest in like biology and healthcare and the medical field, those sorts of things. Because I love the human body. I think it's an amazing machine. There's such minute things that happen in the body that we don't even know about yet. And we're just constantly coming up with more every day. And it's just really exciting. Once I graduated from Chico State, I went onto a dietetic internship. I did this in Morgantown, West Virginia. The rotation that hit home the most was the cystic fibrosis clinic. I work for the USDA as a food inspector, and it's definitely an adventure every day. It's a great place to work so far, and I can't wait to keep on promoting and keep going forward with it. So, to the topic of the day, though, inflammation. So, what exactly is inflammation? Well, if you want a definition, inflammation is our body's basic immune response to any kind of antigen or foreign material. Now, living with cystic fibrosis, we have inflammation at all times throughout our life. And this inflammation can arise because of pathogens, like you can see here at the top of the screen. It can happen because of trauma. It can happen because of chemicals. There is an endless amount of what can cause inflammation in our body. So I'm going to go over just a basic example of an inflammatory process that can happen throughout our lives. So if one day we were to fall down and get a scrape or a cut, we've broken the protective layer of our skin and can allow these bacteria, these viruses, to be able to get into our body. Now, our body not supposed to have all these bacteria and viruses in there, and so it has a system on dealing with that. These cells, these immune cells that are in our skin, they will release a chemical called histamine. That's going to cause the capillaries you can see down here to swell. Now, this is really important because it introduces all of the immune cells and the healing factors that are inside of our blood to the area. And so that will cause all sorts of redness, swelling, pain, that we likely associate with getting a cut, getting a scrape, getting any kind of trauma to the body. Now, because we have all of this blood flowing to that area, this is where our body signals what I like to calling the cavalry, where these cells will enter the area called macrophages to engulf all of these foreign materials in order to clear them out and prevent any further damage. So they'll also engulf any kind of dead cells, dead tissue, those sorts of things to be able to clean up the area. And then other constituents in our immune system will come in and will repair the cut, the scrape, that sort of thing that you can see from this previous slide. So now that we have a basic idea of what inflammation is, we can really talk about how cystic fibrosis and inflammation are connected. So cystic fibrosis, as a lot of you probably know, is a genetic mutation that's caused in a mutation of the cystic fibrosis transmembrane conductance regulator protein. It's a mouthful. But what this protein does is it mainly allows chloride ions to flow in and out of the cell, especially in any kind of mucous membrane tissue. Of course, the biggest ones affected are the digestive system, the lungs, reproductive system, etc. And these proteins are so important because as a chloride ion is being transported across the membrane, it's attracting water. So if you think about our lungs, we have that mucus, just natural. Everybody has mucus in their lungs. And there's also little hairs like attached to the outsides of these tissues that are moving that mucus along, and so that we can end up bringing it up and out. However, without those chloride ions present, like in CF, the water is not attracted to that mucus, and that makes it really sticky and really thick, and allows for all of the bacteria that we breathe in and breathe out to get stuck into that mucus and can eventually find its way and cause all the inflammation that is characterized by CF. So that's probably one of the biggest reasons for inflammation in CF, is because of these just numerous and constant bacterial infections. Our body has an inflammatory response to try and get rid of them, but because there's no effective way of getting the mucus all out, it just is a constant state. There are some animal studies that have been shown that in addition to just having the bacterial infections in place, that in CF tissue, there is an abundance of pro-inflammatory chemicals and not enough of the anti-inflammatory chemicals. So not only do we have a numerous amount of these infections that are causing the inflammation, but we also have, we don't have enough resources to be able to mitigate the inflammation. And that is a really big deal, because if there's no way to mitigate it, then we'll just have it the rest of our lives. And then that can cause all of the symptoms that you see kind of down the line, like the bronchiectasis, which is just scar tissue deposition in the lungs and other tissues. And that is what is really causing our chronic inflammation in CF. So now that we know that we have this underlying chronic inflammation in CFers, the question to ask is what we can really do about it, because there are definitely ways that we can affect this. And with number one being your medications. We see our clinical teams, we have our health regimens. That is our number one defense against this kind of chronic inflammation. But there are other factors too that we can do or that we can do throughout the day in order to bring that baseline inflammation down maybe just a little bit more. Some of them being nutrition, of course, my wheelhouse, exercise, minimizing stress, and even just sleeping better can really have an effect on our overall level of inflammation. Of course, with nutrition, there are a variety of vitamins and minerals that have anti-inflammatory properties, and just getting adequate nutrition alone will provide your body the means to be able to create those immune responses in order to fight back against this inflammation. Exercising, that's always a great idea as well, because your body, you're exercising your body, you're growing your tissues, you're expanding your lung volume, which is always great when lung volumes are diminished because of the infections and whatnot. You're also getting that oxygen proliferated throughout your body to try and better serve your tissues. And it also has a great effect on blood sugar, because there's a mechanism that uses our blood sugar, especially for people with like diabetes and whatnot, to keep that regular, and it's only mediated through exercise, which is crazy. Of course, minimizing stress, there's been a bridge between stress and inflammation, and that when you have chronic stress, that your inflammation rises too. So everybody has their own ways to de-stress, but to always try and put that into your schedule, because you always got to spend time on you. That's number one, right? And then sleep. When we get into our deep portion of it, that's the body's way to restore itself. It's the way everything, it's almost like the night shift. When everybody's cleaning up and wherever you work, and they're trying to get it ready to go for the next day, that's exactly kind of what's going on when you're sleeping. So to get that ample amount of time for your tissues to regenerate, or for things to grow, like that needs time. So you need sleep. So the reason to care about affecting the chronic inflammation that is going on goes directly into quality of life. With it, say you make a small change, say whether it's in your medication, whether it's in nutrition, whether it's in exercise, you've taken, if we think of it as a level of inflammation, and you've decided that I want to make this change, you are going to bring your inflammation from here down to here. And while it may not seem like the biggest thing, it's really the longevity of continuing that habit that is really going to have a profound effect on your quality of life later on. Being very practical and trying to be very efficient in making changes, that's the one benefit I feel like CFers have, is that we're constantly going to clinic, we're constantly running the numbers, and outliers happen, we get sick and that sort of stuff happens. But for the most part, you can see the change in your lung function, or your vitamin levels, and all of those are wins. There's nothing that you can do to try and combat this disease that won't be a win. As long as you're trying your best, and as long as you are putting forth the effort and taking responsibility for, like, this is me and I want to give myself the best chance that I can to live the normal life that I deserve, I feel like will always be a win.